Hello class, my name is Ernesto Lemus Cruz. This is Hearst University, NU 670 Advanced Psychopharmacology and Health Promotion. Today we will be talking about perinatal lactation, considerations for prescribing, teratogenicity, physiological considerations of pregnancy. Mental health disorders has been in an increased rate. They account for approximately 32% disability. They affect the physiological being of an individual. They also affect the pregnant and lactating population. Treating the disorder has been challenging, rendering the complication of taking the drugs. This presentation looks at mental health needs. It's focused on the perinatal population. The mental health disorder has increased in an alarming rate, according to the report of Kilburn 2021. These disorders account for approximately 32% of the disability across the globe. The critical of mental health disorder is that they affect the individual's mood, behavior, and thinking of individuals like any other individuals. Pregnant and lactating mother has been reported to be affected by mental health disorder. Nevertheless, despite the effort by the health practitioner to take care of this issue, treating mental health disorder to the pregnant and lactating population has been a challenge. This is because the providing drugs are accompanied by several side effects and contraindications. The current is a presentation discussing the mental health needs of perinatal population. The focus population is perinatal. The term denotes the period between conceiving and give birth, mostly referred to a pregnancy period. The perinatal population is classified under a risk population, the major risk being major depression disorders episode. In the United States, perinatal mental health is a critical issue. The severity of the disorder affects both the mother and child. As mentioned in the preceding slide, the current presentation focuses on the mental health needs of the perinatal population. The population is defined as those individuals in the period between conceiving and giving birth. In simple terms, this is referred to as the prenatal population. According to the Center for Disease Control and Prevention (CDC), this population is classified under the at-risk individual. According to Samari 2019, one of the critical risks of this population is major depressive episodes. This makes perinatal mental health a critical an issue in the United States. The reason being that the severity of this mental health disorder affects both the mother and the unborn child. Prevalence of mental illness. Mental illness has been an increase in pregnant women. The prevalence has shown different rates. About 10% of these women has mental illness. Approximately 15.6% of the women are from developing countries. The severity has a result to suicide. A large number of mental disorders are untreated. About 5.5% of the pregnant women use antidepressants. As it has been mentioned previously, mental illness has been an alarming rate, particularly in pregnant women. Across the medical report, the prevalence of mental illness across perinatal population has shown differential rates. For instance, a report by the World Health Organization reported that about 10% of the perinatal population are affected by mental illness. The organization is keen on highlighting that the rate is high in developing countries with 15.6%. Unfortunately, this rate has accounted for several suicide incidents. This is because a large number of these individuals go untreated. Another statistical report by Gomez 2021 showed that due to the mental illness, about 5.5% of perinatal population are taking antidepressants. Some psychopharmacology treatment considerations. There has been a challenge in psychopharmacology treatments for perinatal populations. It is due to the complexity of prescribing. The medication may affect further neurodevelopment. SSRIs and benzodiazepines are the mostly prescribed. However, benefit and risk are considered during prescribing. These considerations include neonatal symptoms risks, teratogenicity risks, and long-term effect risks. So now we want to talk a little bit about contraindications. Issue has been raising to antidepressant prescriptions. The issue has been mainly in perinatal population. Not all drugs are approved. This is due to high side effect rates. Fluoxetine and paroxetine are contraindicated in first trimester. Temazepam is contraindicated in pregnant women. Atenolol use is contraindicated in the second trimester. Effect of no treatment. Perinatal is a vulnerable period. Mental illness individuals at this period are at significant risk. This is especially if they receive no treatment. One negative effect is suicide. Lack of treatment can also lead to the maternal mortality. Self harms can also occur if mental ill pregnant women are not treated. Um, so now I'm gonna make a little summary to talk about everything together. So mental health disorder account for 32 disability. About 10% of this pregnant women has mental illness. About 5.5 of pregnant women use antidepressants. Challenges are in pharmacology treatment of perinatal population. SSRIs and benzodiazepines are the mostly prescribed. Consideration have neonatal symptom risk, teratogenicity risk, long-term effect risk. Fluoxetine, temazepam, and atenolol are among the contraindicated drugs in psychopharmacology treatment in perinatal population. See, so here I'm gonna leave all the reference that I've been using during the presentation, so you can see it. So thank you so much for listening about this presentation. I think that perinatal and lactation is a very important special group population. So we need to be aware about that, and we need to be aware when we will not prescribe any medication for this group of population. Thank you.